Hi, let's do an Ezpap today. Ezpap is an exceedingly simple device. You get this device in the bag with a mouthpiece, and this device is connected to a flow meter, and a good starting place is at 5 liters per minute. So I'm going to dial in 5 liters per minute. Now what that does is that provides an expiratory resistance that the patient can blow against. This treatment requires the patient to be active, an active participant in the treatment. Now, so we can see how much pressure they generate as they exhale against the device. I have a little pressure manometer here, which I'm going to put on right here. I don't know if you get a close-up of that. Okay? So there's my pressure manometer. It has a little black ring that I can set at 20, and I'm going to try to ask the patient to generate pressure somewhere between 10 and 20 on exhalation. So let's watch and see how much I get. Now there's two parts to this treatment. One is the pressure they generate, and number two is how long are they able to generate that pressure. And so the benefit from a lung expansion standpoint is going to come from those two things, from generating that positive pressure and maintaining it for a long expiration. The patient will use their own muscles to do this. And hopefully this will generate back pressure that will then help to prevent or reverse any atelectasis that's there. If the patient's comfortable with that, you can turn the pressure up. And I can do that by manipulating this flow meter here. Let's turn it up to about 7 and see what kind of pressure that I generate. And of course I'm watching the red ring. So that's exactly what you want for the patient to do. You want to have them generate a long expiratory pressure, and it takes some coaching. And now that you have an idea of how to do the Ezpap, let's add something to it. Let's add a nebulizer treatment with that. So bronchodilator therapy can be accomplished with a simple twin jet nebulizer, if that's what it's still called. And I can put the mouthpiece on the nebulizer and put the nebulizer in between the Ezpap unit. The nebulizer is between the mouthpiece and the Ezpap unit with a 22mm connector connecting them both. Okay, now that I have my Ezpap spliced in with the nebulizer, of course I'll need a second flow meter. The second flow meter will be to power my nebulizer. And then I'll turn my nebulizer on what any typical nebulizer treatment would be run at. And now, again, the same way, breathe in deeply. A few final thoughts. Be sure to coach your patient well in order to get the best effort. Number 2, don't be afraid to turn up that flow meter in order to get more pressure, in order to challenge your patient. Sometimes you could go as high as 30 on that pressure if the patient can tolerate it and if they're doing a good job. And finally, be sure to assess whether the patient is benefiting from the treatment frequently, because if they're not, you may have to try something more aggressive such as IPPB. Thanks for coming.